Hi, everyone. This is Dr. Emily Park, and I am meeting with Jacqui today. Jacqui is our certified clinical nutritionist at Arizona Wellness Medicine. Jacqui, thanks for joining me today.
Thank you for having me.
Awesome. Okay, so I am going to just jump right in. I'm going to have ask some questions and get people to really get to know you a little bit. So tell us, how did you get started in the clinical nutrition field? What's your pathway?
I spent a good chunk of time working in the emergency department as a technician. So I was definitely in the patient care realm, seeing patients, chronic health issues, acute patients. And it was really there that I kind of had an eye-opening experience regarding the medical field and the need for more preventative care. So that was kind of what sparked my interest in preventative care. Once I found out about functional medicine, this was something that I knew would be the future, especially with my experience working in the ER. So that was kind of the first seed. And then I did spend some time living in Guatemala, which was a wonderful experience doing some medical Spanish work, learning Spanish, something I was really a passion of mine, especially being in the emergency department. And when I got back, I had a little souvenir in the form of a parasite and kind of went through my own health journey. So not only did I learn about functional medicine, but I became a patient of a functional medicine provider, went through my whole gut healing journey with my parasite, which developed into SIBO, healed my SIBO. It took a long time, but I think the personal experience really lit my fire to really invest in the education in functional medicine and nutrition. This is really when I learned how nutrition can make a really big impact in my health. Got my master's in human nutrition and functional medicine, did a residency in a functional medicine clinic, and been working in the field ever since. So yeah, that's kind of a brief overview of my journey.
Awesome. That's an awesome pathway. And you guys, it wasn't just anybody's clinic that she did her residency in. It was Dr. Kara Fitzgerald. If you
Yeah.
follow her, she has a great podcast and she has been a functional medicine pioneer and educator all along. So Jacqui's super, super, super experienced. And just like most of us sitting here doing functional medicine, we had, she had her own journey that, sparked her to do what she's doing right now with us.
Yeah.
Um, awesome. Okay. Tell us, so just to kind of back up just a little bit, at Arizona Wellness Medicine, every new patient gets 2 health coaching visits associated with their new patient visit. But the reason Jacqui's with us now is because we found that a lot of patients have a deeper need. They want more nuts and bolts, let's say, with nutrition. They want, calories or macros or like, super specific recipes and just help with, really dialing in nutrition. So that's why Jacqui exists. But tell us how you've structured the package and how it works because we've got a 3-visit package with Jacqui. And so tell us how all of that works.
Yeah, so my initial appointment with you is really just getting to know you, what your main concerns are. We definitely dive really deep into the nutrition and lifestyle piece. I get into what a typical day in your life looks like, where you grocery shop, what your cooking skills look like. All this is really important information for me to meet you where you're at, right? Everyone has a different experience with nutrition. A lot of people have a variety of relationships with food too. So we touch on that and we kind of assess exactly what makes sense moving forward with a nutrition plan. So that initial appointment is really just me gathering information, maybe lab work that you've been doing at AZ Wellness Med already, maybe what you've worked on with a health coach already. And with that, I kind of determine, where it makes the most sense so we can really make changes that get you towards your goals. And this could be a small change. This could be big changes. But really that first appointment is my assessment. From there, we'll have a follow-up appointment where we go over your personalized plan. This is where we dive into not only the nutrition piece of like what foods to include, what foods to possibly avoid, but also like the foundations of nutrition. I find that over my years of working with patients that the foundations of nutrition are still something that needs to be learned. And what I mean by that is meal timing, balancing our meals, what our meals should be looking like. And I think that when I start to explain these concepts to individuals, that they're kind of eye-opening experiences for them. They might not know the importance of protein, fat, and fiber in one meal. So we go over that in detail.
Great.
And again, depending on the protein will be based off of what you told me in your first appointment, but depending on the carbohydrates and the type of fiber, we will personalize all of that. But yeah, that's the second appointment is really for you to look at your plan, look at the recipes that I recommended and be like, this isn't going to work for me, or this sounds great. I make adjustments based off of that appointment. You go forth and implement the plan. And then our final appointment is assessment, seeing how you're doing, reevaluating how the nutrition plan is going. When it comes to calories, macronutrients, things like that, that's really happening that first appointment. One of the biggest things, the biggest job for me is to understand if you are overnourished or undernourished.
Sure.
And it could go either way, right? So we may get into that on that second appointment, getting into maybe the grams of protein that I want to see in each meal, the grams of fiber I want to see in each day. We may do some tracking, depending on your comfort level with that. But if we don't know what you're at with baseline in terms of those calories, protein, carbs, fat, and fiber, we don't know where we want to go and what areas of improvement we need.
Yeah.
So I think that's an important step. A lot of times, even in my own personal experience, I don't recommend tracking all the time, but if something isn't going right, if we need to maybe take a look at, we need to look at the data, and that data is your nutrition intake. So many times people are under eating. I know it probably seems counterintuitive, but we've seen a lot of intermittent fasting taking over, and the amount of food that we're taking in is low, meaning that the amount of nutrition and nutrients that we're getting is also low. So really seeing that data, looking at your micronutrient intake and your macronutrient intake, meaning vitamins and minerals, carbs, fat, and protein, can be an eye-opening experience for you to be intentional with your meals. So that's kind of a brief overview. We're definitely diving deeper into the nutrition piece, maybe compared to the health coaching piece. But that's really what I'm passionate about, and coaching and educating people on.
Love it. And those three, the first visit is 75 minutes and the second two are 60 minutes. Is that right?
Yeah. Yep.
These are long appointments, you guys, where she is really going to get in there with you and help make it super personalized. So this is why we've brought Jacqui on board. Please take advantage of her services. She's super, super, super experienced and knows so much. Jacqui, is there anything else you want to add about you and your services?
I guess I will just kind of put a little bit of my philosophy on nutrition. This really stems from the functional medicine model regarding nutrition. It is a variety of things, but the main points is nutrition is fuel for our body. It keeps us going. It keeps those wheels turning to give us energy, which we all want. It's also information for our body. So it's a signal to what is needed, what is lacking. That's the big part that I work on. And of course, it's connection. So it's really that social aspect that I'm very much aware of and emphasize in my coaching as well.
Yep. Food is medicine, right?
Yep.
Love it. Awesome, Jacqui. Well, thank you so much. And we look forward to working with you.
Thank you.